Have you ever considered how implicit biases can affect healthcare outcomes? Then it's time to uncover the truth and explore practical solutions. So, hi, my name is Tamisha Campbell, and I am the founder of Enhance Black Women's Health. And as you know, implicit biases can unknowingly influence our decisions, but awareness and action can significantly impact us. And that's why this video is going to dive into 5 strategies to address implicit bias in healthcare. And ensure you stay to the end because we're going to share a bonus tip for reducing implicit bias in healthcare. Now, I'd love to hear from you. How have you seen implicit bias affect healthcare outcomes? Please share your thoughts and experience in the comments below to start a meaningful conversation. And now that we've got that covered, let's dive into the tips. Strategy number 1, self-reflection and awareness. By examining our biases and acknowledging their existence, we can actively work toward overcoming them. Imagine for a moment a healthcare professional engaging in self-assessment to identify their unconscious biases and actively work towards challenging them. By recognizing their biases, they can ensure that their patients' interactions are fair and unbiased. Therefore, we must reflect on our thoughts and assumptions and attitudes to provide honest and unbiased healthcare delivery. Strategy number 2, diversify the healthcare workforce. A diverse healthcare workforce allows for a broader range of perspectives and experiences. For example, a healthcare organization might recruit and hire professionals from diverse backgrounds. Doing so shows their patients they value an inclusive environment that promotes diversity and representation. Hence, the organization can provide culturally sensitive care and mitigate implicit biases by having a workforce that reflects their communities. Strategy number 3, implement evidence-based protocols. Evidence-based protocols can standardize care delivery and minimize the impact of implicit biases. For instance, a hospital or a clinic might establish evidence-based protocols for treating patients with chronic conditions. And these protocols ensure that every patient receives the same level of care regardless of their race, their ethnicity, or their socioeconomic background. And by following established guidelines and protocols, healthcare providers can minimize implicit bias in treatment decisions and ensure fair treatment for all patients. Strategy number 4, promote culturally competent care. Culturally competent care involves understanding and respecting diverse cultural beliefs, practices, and values. So again, let's use the example of a medical institution that invests in cultural competency training for its staff. They do so knowing that when healthcare providers participate in workshops and educational programs like this, they'll enhance their understanding of diverse cultural beliefs and practices. Now, this benefits the institution and the patients as providers will be better able to deliver care that is respectful, responsive, and aligned with each patient's specific needs. And then strategy number 5, engage in community partnerships. Building strong relationships with community organizations and leaders can foster trust and collaboration. For instance, a healthcare clinic might partner with local community organizations such as like an ethnic community center or an advocacy group. By working together to organize health fairs, workshops, or even outreach programs, they can identify different health disparities and develop targeted interventions that positively impact the community. Thus, healthcare providers and community partners can address specific healthcare concerns within the community and bridge the gaps in healthcare access through targeted interventions. Hence, these tips are a great place to start when making a real impact in creating a more equitable healthcare system. So let's recap our strategies for addressing implicit bias in healthcare. Self-reflection and awareness, diversify the healthcare workforce, implement evidence-based protocols, promote culturally competent care, and engage in community partnerships. By employing these strategies, we can make a significant impact on reducing health disparities and promoting health equity. And a bonus tip, stay informed and stay engaged. Keep up with the latest research, attend relevant workshops and conferences, and engage in conversations around health disparities. By staying informed, you can continue to expand your knowledge and contribute to creating a more equitable healthcare system. And if you're ready to take action and make a difference, I invite you to download our free Health Equity in Practice guide. This comprehensive resource offers practical and effective interventions to promote equitable healthcare. The link to download the guide is in the description box below. And together, we can create a healthcare system that leaves no one behind. Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.